If a coin-sized patch of hair loss showed up overnight, you're not going bald. Your immune system has just crashed the hair follicle's privacy settings in what is called alopecia areata. In the next few minutes, I'll show you what predicts regrowth, which treatments actually help, and how to protect both your hair and your mental health starting this week. Hi, I'm Dr. Jonathan Hopkirk, Sydney-based hair loss doctor and founder of Levels of You, an Australian-based hair restoration company and proud sponsors of the Australian Alopecia Areata Foundation. And this month, it's Alopecia Areata Awareness Month. So in today's video, I'm going to give you an updated breakdown of what alopecia areata is, the different types of alopecia areata, and then the recommended steps you can take to ensure you have the best chance of recovery based on the most recent 2025 evidence. And as always, if you'd like to get your hands on our Medical Board's hair loss ebook or to get $300 off this Grow laser cap, simply watch to the end and follow the prompts. All right, let's jump into it. So what is alopecia areata? So when I connected with the founder of the Alopecia Areata Foundation this last week, she wanted these three important facts to be known. One, alopecia areata is frequently dismissed as a cosmetic condition. However, it can be a deeply traumatic experience, and it can result in emotional and economical pain and social isolation. Number two, it is estimated that 2% of people worldwide will experience alopecia areata in their lifetime. That's 160 million people globally. And three, alopecia areata is not life-threatening, but it is life-changing. So we know it has a huge impact on people, but what exactly is it? Well, alopecia areata is an autoimmune condition that causes non-scarring hair loss. So think of a hair follicle as a quiet library with no talking rules, aka immune privilege. In alopecia areata, that sign comes down and immune cells start talking where they shouldn't be, pushing hairs prematurely into shed mode. So it's a chronic condition that primarily affects hair follicles and nails and can, in some cases, involve the retinal pigment epithelium. The lifetime risk is roughly 2%, as I said before, and it can affect any age and gender, of which children actually account for about 20% of all cases, and about 60% of adults experience their first patches before age 30. About 10 to 40% of patients will also experience nail involvement in the course of the condition, which manifests as nail ridging and pitting that also correlates with the severity of alopecia areata. What are the various types of alopecia areata? When there is one or a few patches on the scalp, this is called alopecia areata. When these patches are in the beard, this is called alopecia barbae. A band-like strip of alopecia on the neckline is called alopecia oophiacis. Diffuse hair loss of the scalp that mimics telogen effluvium is called alopecia incognita. Total hair loss of the entire scalp is called alopecia totalis, and a total hair loss over the entire body is called alopecia universalis. How can we tell alopecia areata from lookalikes? So before you panic, here's a self-check to discuss with your clinician. Alopecia areata tends to be patchy, well-defined, with classic clues like exclamation mark hairs, black dots, yellow dots, and sometimes nail pitting. If you notice pain, scale, pustules, or shiny thin skin, fast-track a dermatology review to rule out scarring forms. What actually drives alopecia areata? So the best supported model is loss of immune privilege around the follicle. And there's also been a paper released in 2015 in China about a possible trigger being a certain type of dust mite, which is pretty interesting. Psychological stress is commonly identified as a trigger for alopecia areata. Approximately 23% of the patients report an emotional crisis or significant traumatic event preceding the onset of exacerbation of this condition. In alopecia areata, psychological stress activates the HPA axis, leading to the secretion of neuropeptides such as corticotrophin-releasing hormone and substance P. These neuropeptides disrupt the immune privilege of hair follicles, which normally protects them from immune system attack, as we detailed earlier. Risk and modifiers can include genetic susceptibility and environmental factors like stress, sleep disturbance, smoking, alcohol, and even gut factors. These don't cause alopecia areata alone, but they can tilt the immune balance. The 4 Ps that predict your action plan. So to choose the right treatment, your health professional can quickly profile the disease using the 4 Ps. Number 1, percent of hair missing. This is categorized using the SALT score. Your SALT score will be S1 if there is less than 25% hair loss, S2 if there is between 25 to 49% hair loss, S3 if there is between 50 to 74% hair loss, S4 if there is between 75 and 99% hair loss, and S5 if there is 100% hair loss. Number 2 is the places involved. So if it's scalp only versus brows, lashes, beard, or other parts of the body. Number 3 is pitting, so nail changes can correlate with the severity of the condition. And number 4 is past, so the duration of any prior episodes, recurrences, or family history, for instance. So these 4 P's are essential in gaining a good understanding of severity and also will guide the management plan. So here's the 3-lane roadmap that doctors can use with patients. It's simple, practical, and easy to act on. Lane 1, regrow. So you want to match the medical therapy to the severity. If you've got limited patchy alopecia areata, then usually either topical or intralesional corticosteroids will be commenced. Often this is supplemented with topical minoxidil as well. If your alopecia areata is more extensive or stubborn, or you have a higher SALT score or multiple sites like brows or lashes as well, then systemic options including JAK inhibitors may be advised. In select cases, additional methods like PRP or newer options like exosomes may be used to supplement the traditional therapies. Lane 2, protect the appearance. So quick wins you can do today. You can use things like strategic clip downs, hair fibers, or even consider a scalp micropigmentation consult. You can also explore wigs or toppers if that feels right for you. For brows, you can start with pencils or serums, but be cautious with microblading. Don't forget scalp SPF or hats, and ask for school or workplace notes if you need head coverings. Lane 3, protect your well-being, because alopecia areata affects more than just hair. Screening for anxiety and low mood is really important. Alopecia areata and mental health influence each other, and support makes treatments easier to stick with. It's definitely advisable to join reputable patient groups and get guidance from your professional to form a short script for talking about alopecia areata at work or at school, so you're not carrying this alone. Match your lane to your SALT scores, the areas involved, and how it's impacting your life. Then move forward with the plan you can actually live with. So what are JAK inhibitors? So JAK inhibitors quiet the inflammatory crosstalk that keeps follicles under attack. They can be considered with the decision triad, that is the extent, so the SALT score, sites involved, the impact on the patient's function, mental health or occupation, and readiness, as it involves monitoring, and there's also a contraception consideration, and there's a cost and accessibility factors as well to weigh in. They're promising for the right patient profile, but they're not needed for every small patch. 3 alopecia areata myths to retire. It's just stress. Well, stress can modulate alopecia areata, but it does not single-handedly cause it. Number 2, biotin cures alopecia areata. There is no good evidence it reverses alopecia areata. Spend any dollars on proven care. Number 3, oils and lasers alone can fix it. It may help comfort, but it doesn't necessarily address the core of the condition. So your 7-day starter plan. Get photos today. On the front, the sides, the crown, all in the same light. 2, book a GP derm appointment and ask about a SALT score and nail check. Number 3, list triggers from the last 3 months, so illnesses, meds, weight changes. Number 4, pick one appearance aid for immediate confidence. Number 5, practice gentle hair care. So use low heat settings on any styling devices and have low tension with any hairstyles. Number 6 is lifestyle basics, so sleep, protein, iron-rich foods, don't crash diet. And number 7 is follow up every 6 to 8 weeks initially to adjust the treatment course. So in closing this discussion, alopecia areata isn't your fault, and it's not hopeless. The majority of people with mild alopecia with only 1 or 2 patches tend to have a full recovery within 12 months. If the treatment plan intensity is matched to your pattern and your life, you've got a good chance of recovery. If this helped you, please like, comment your questions, and share with someone who you think may need it. And if you'd like to get your hands on our Medical Board's free hair loss ebook, or get $300 off this Grow Laser Cap that I've personally used myself for 16 months, simply like, subscribe, and email me at jonathan@levelsofyou.com and I will get that sorted for you. Look forward to seeing you again next week as I bring another hair loss video to you. Hope you have a good week this week, and I hope you're all well. Look forward to continuing to help you on your hair loss journey. Cheers.